More than 1 million doses of the Janssen & Janssen COVID-19 vaccine donated by the government of the United States arrived in Vientiane on Friday evening. The official handover ceremony was held on Monday afternoon when the senior government official of Laos said the 1,008,000 doses of Johnson & Johnson's Janssen vaccine will be used by the Lao government to provide protection against the coronavirus to more than 1 million people, representing about 14% of the total population, as it only requires a single dose. The Lao People's Democratic Republic has received 1,008,000 doses of Johnson & Johnson's Janssen COVID-19 vaccine donated by the government of the United States through the COVAX facility, a partnership co-led by the Coalition for Epidemic Preparedness Innovations, or CEPI, Gavi, the Vaccine Alliance, and the World Health Organization, or WHO, with UNICEF as the key delivery partner. The donation is part of the United States' contribution to global efforts to end the pandemic and support for Laos' goal to vaccinate 50% of its population by the end of this year. The Vice President of the Lao PDR, Madame Pani Yathotu, expressed her gratitude to the United States and the American people for assisting Laos in its fight against the coronavirus. These vaccines will assist Laos in more effectively dealing with the COVID-19 pandemic. U.S. Ambassador to Laos, Dr. Peter M. Heyman, said the donation is part of the United States' contribution to global efforts to end the pandemic and support for Laos' goal to vaccinate 50% of its population by the end of this year. The 1,008,000 doses of Johnson & Johnson's Janssen vaccine will be used by the Lao government to provide protection against the coronavirus to more than 1 million people, representing about 14% of the total population, as it only requires a single dose.
The U.S. government began helping the Lao government prepare for a pandemic many years ago, because we all knew that a pandemic would come. There had been pandemics before, there would be again. And so we helped in training and preparation so that the Lao doctors and epidemiologists were ready when this came. And that has, I think, played some small part in helping the very strong success of the Lao government. We are doing our best now to help support the Lao government in its vaccination campaign for this year and after. As I said, we're giving COVAX. We are sending to countries around the world, including Laos.
The plane carrying the vaccines landed at Wat Tai International Airport in Vientiane on Friday evening. The Minister of Health, Dr. Bun Phang Phumalaisit, the U.S. Ambassador to Laos, Dr. Peter M. Heyman, and other officials and partners welcomed the arrival of the vaccines at the airport. The delivery of the vaccines come after U.S. President Joe Biden announced in June that the United States would purchase and donate 500 million doses of COVID-19 vaccines to 92 countries, including Laos. Some 200 million doses will be delivered by the end of this year, and the remaining 300 million will be delivered in the first half of 2022. In addition to this latest shipment of the Johnson & Johnson COVID-19 vaccine, Laos previously received a shipment of 132,000 doses of the AstraZeneca Oxford vaccines in March, and a shipment of 100,620 doses of the Pfizer-BioNTech vaccine in early June. Both these shipments are procured through the COVAX facility. Japan recently announced the donation through the COVAX facility of 616,000 doses of the AstraZeneca vaccine manufactured in Japan for the people of Laos. This will further boost the vaccination program of the Lao government. Vaccination coverage is expected to rise to 50% of the population by 2022 and to 70% in 2023, with more people to be vaccinated in the following years. All vaccines take time to provide immunity, and no vaccine can be guaranteed to provide total immunity in every individual. Laos also received its first shipment of the Oxford AstraZeneca COVID-19 vaccine last month through the COVAX facility, a partnership between the Coalition for Epidemic Preparedness Innovations, Gavi, the Vaccine Alliance, UNICEF, and the World Health Organization.